Welcome to the Happy Doc, the voice of fulfilled physicians. This show is about bringing inspirational, creative, successful, and happy health professionals to you. Get ready to learn how you can be a happy doctor too. Hello everyone. For this episode, it's really exciting to have our next guest, Dr. Michael Farrell. And for those who do not know what PM&R is, he's going into physical medicine and rehabilitation. And it's a very interesting field. We get into a discussion about what that looks like for him. To start off, his path is very non-traditional. So he went from being a teacher to being a chiropractor and then ultimately moving into medical school. So he has an interesting scope of practice. On top of that, he has a website he works on with co-director Jim Eubanks called Ability Science. He then has moved on to also working on a vlog called M.E. Farrelly TV that he has on YouTube, which talks about his personal experiences within medical school and now as a resident. So it's just a really great thing that he's doing, using his personal creativity and voice to promote the work he's doing and showing off his life. So guys, we drop a lot of bits of wisdom in here. We learn about Dr. Michael Farrell and his work, and it's just awesome to hear his story and get to know more about what he does. So I hope you guys enjoy this conversation. And if this conversation has impacted you in any way, please leave a review, a like, a comment on our social media channels. It would be great for you to leave a review on iTunes because that definitely gets us to be more well-known. But we definitely appreciate that. And without further ado, let's listen to Dr. Mike Farrell. Hello, everyone. This is Taylor, and this is another episode of the Happy Doc. I'm really excited to have our next guest. That's Dr. Michael Farrell, and he currently goes to the National Rehabilitation Hospital. He is studying PM&R, or Physical Medicine and Rehabilitation. He is an intern. Also, and what gets me really pumped is the fact that he has this really cool vlog called M.E. Farrelly TV. That's MEFARRELLII TV, and you can search that on YouTube. He also has this great project called Ability Science, and we'll definitely talk about that as well. And that's actually how he started his vlogging. So, Mike, can you introduce yourself?
Yeah, sure. So, Mike Farrell, originally born in Buffalo, New York. I moved to New York City a few years ago to complete clinical training, and now living in Washington, D.C. Always kind of been a big sports fan, and then also played sports myself. Was lucky enough to play Division I soccer, and that sports background and just kind of looking at the world from a more functional standpoint from being an athlete is kind of what pushed me into the career path that I've chosen and how I ended up with physical medicine and rehab and choosing that as my chosen specialty.
Awesome. Great. Well, it's awesome to have you. And we can definitely, let's start off this conversation actually. So how do you think that being an athlete contributed to your decision to go into medicine? What was it? Did that help? Did that take away? What was that process like? And how did that affect your decision making?
Yeah, I definitely think that as an athlete, we value our bodies more because it's kind of the vehicle as the way that we get things done. And when you injure yourself or when you are not able to perform, it impacts your life in a profound way. And you don't really think about that too much until something happens and until you can't go and, in my case, play the sport that I love to play. But in the minds of, and in my patient's eyes, it's when something happens, something catastrophic, where they can no longer just do day-to-day life things. And never thought I'd think about it that way because as a young man, you don't really think about that too much, about things happening to you. But then as you see it kind of going on around you, you realize that health issues and medical conditions can really impact people's lives and the way that they live. And it's very similar to my kind of perspective as an athlete, and looking at my body as being something that like I needed to be at tip-top shape every day, just to perform.
Definitely. Yeah. So, you're an athlete. Obviously, you had to maintain your system to perform well. Was there like an impactful moment maybe that, made you feel like you wanted to help other people perform better, make sure that their bodies were in shape? Were you a coach? Did you have an impactful patient experience? I'm just trying to see, what was that for you? What got you excited?
My path into medicine was very non-traditional. If there's ever a definition of non-traditional, I think my story would kind of be up there. I started out thinking that I wanted to be an elementary or special education teacher. My mom actually was an RN. She worked at a school for developmentally disabled children, and every summer I volunteered there. And I think it was those experiences that kind of turned me on to helping other people who were in need, and specifically those who needed help functioning and trying to live their lives as able as possible. And lots of my students that I worked with had cerebral palsy, were in wheelchairs for most of their lives, yet just like every other 10, 11, 12-year-old, they had those desires inside to want to do things, to play sports, to go to dances at school, have the same experiences that any other 10, 11, or 12-year-old would have. And so I think that those initial experiences helping these kids really was what kind of lit that fire. And I thought the best way for me to do that would be through teaching. And throughout the student teaching process, and completing my coursework, I realized that teachers have a tremendous responsibility, and a lot of the times they can't give the individualized focus that is needed to really help these kids, because they're responsible for managing 20, sometimes 30 lives, and that makes it very difficult. And it was at that time that I said, I don't know if teaching is necessarily where I will stop this journey. I think that this is going to kind of continue on. But I think it was those initial experiences working with those kids and seeing the difference that it could make when, some of these professionals came together, and whether it was their physical therapist or occupational therapist or their teacher or their parents or their physicians, kind of going above and beyond to give them the tools that they needed to live a life that's as able as they possibly can, in whatever definition that was to them, and it varied for each kid.
Sure. So out of curiosity, you obviously had this special connection with these kids who had functional disabilities. Is there for PM&R specifically, is there a subspecialty that lets you focus on children or individuals with those specific diseases? Just out of curiosity.
There is. There is a pediatric PM&R, kind of a separate residency program, but I think there's only one or two that actually exist in the country. However, one of the things that really attracted me to National Rehab Hospital was the fact that they have a very large adaptive sports program, and I was able to, throughout my life, kind of combine the two worlds of me, being an athlete, and then me also having this passion for helping the special needs population, and had a lot of experience with camps and kind of being a coach, working with adaptive sports, and kind of seeing how that can add fulfillment to these to these kids' lives, and make them able to do things that they might not have been able to do before. And so my rotation at National Rehab Hospital and seeing that they had that experience was kind of the thing that pushed it over the edge. I mean, the people that were there, and the experience that I had, and just seeing how happy the residents were was the first thing. And then learning about this adaptive sports program and kind of seeing how I could marry those two, worlds together was
Sure.
the final thing that was just, I knew that that's where I wanted to be. It just felt right.
Mike, can you explain adaptive sports for myself and the listeners?
Sure. So adaptive sports are ways that we can look at sports and be able to allow children that may have limitations and whether the functional limitations to be able to perform and play those sports. So the perfect example that I always try to use for people, because I think that people are familiar with it, is sled hockey. Sled hockey would be an adaptive sports for those who are athletes who do not have use of their legs but have use of their arms. They can get into the sled and use that, and that's a way to adapt the game of hockey for someone who may not be able to play the traditional game. And so that adaptation is what we refer to as adaptive sports. And really, it can be anything, any way that you can look at a sporting activity and change that so that someone who's not completely able to do that, for them to be able to do it, that would be an adaptive sport.
That's awesome. I love that. And so you're allowing these individuals who might have functional problems to be able to do what they love, and make sure that their anatomy works with that game. That's really cool. I love that. Go on.
I think that my experience teaching kind of opened my eyes to that, because it's very easy, especially as a younger man. I mean, when I started going with my mom, I think I was maybe 10 or 11 years old. That when you see people in a wheelchair, when you see somebody who functionally can't perform at the level that you would expect them to, the tendency is to think, well, mentally, are they functionally at that level? And what I learned very quickly is that your body's ability has nothing to do with your mind's desire to want to do things. And these kids, just like every other 10 or 11-year-old, loved the Sabres. Being from Buffalo, we have the Sabres and the Bills here. They loved their sports teams, and just like any 11 or 10 or 11-year-old, they wanted to be able to emulate and feel like they were their Pat LaFontaine and Alexander Mogilny. Like at the time, those guys were the big Sabres players. They just wanted to go out there and be able to experience that and feel that. And sometimes I think you can look at them and think like, oh well, do they really have those desires? And I learned firsthand that they do. And when they're out there and they're able to, you're able to kind of like adapt their wheelchair to have a little hockey stick on it, and they can go out there and play hockey, something that they may have never thought they did. That's the kind of unadulterated joy that you saw in these kids was just infectious. It was unbelievable and extremely life-changing for me.
That's amazing. I love that. And something that you said that was really profound, or you alluded to it, that I think was really great is, sometimes your mind or these children's minds were ready to kind of do those activities, but their bodies might not have been able to follow suit. And, with the adaptive, training and the adaptive sports programs, you're able to kind of be that bridge to then let the body follow through on, what their desires are. That's so cool. I think that's amazing. And so to follow up, we mentioned, your progression into kind of going into medical school, into PM&R a little bit. Mm-hmm. Can you explain how that developed, and then ultimately you guys designing Ability Science with your co-director, Jim?
Yeah. So after I kind of made the decision that teaching may not be the last stop for me on the educational trail, I kind of took a step back and thought about, well, what is it that I wanted to do? My mom being a nurse was influential in the sense that she said, well, what about something in the medical field where you are allowed to be more individualized because you can really give however much time you have to that one person. So, if your office visit is 30 minutes long, you can spend 30 minutes just working with one person on trying to make their life better in some way, as opposed to feeling like you had to spread it around, 30 different people. And I said that's a good point. However, for me, I always had looked at my own health problems and thought about them in different ways of how I could approach them. My last choice wanted to be taking medication or needing to, have a surgery or do something like that if I didn't need to. And so physical therapy and strength and stretching and those types of things all became kind of integral parts of my routine to keep myself in shape. And that made me think about what profession could I do that would kind of be along that similar line, would allow me to have that individualized approach to working with children and their parents and getting them connected with the right services. And that's kind of where chiropractic came into the picture and where I was introduced to chiropractic and what kind of made me pursue that. Being somebody who wasn't a traditional med student, I didn't have some of the prerequisites, and some of the prerequisites that I took were might not have counted because they were taken at different, like a community college at the time, and so a lot of that was me in hindsight wishing that I had done things differently, and then kind of trying to find the best fit for me in terms of what I wanted to do. And that's kind of what led me to chiropractic. And really when you look at chiropractic and what its focus is, looking at the body as a kind of a vehicle and making sure that it's functioning as optimal as possible to allow people to do things, it just made a lot of sense. Like the progression made sense. However, I didn't know some of the limitations that chiropractors faced and some of the issues that they had with scope of practice, and then also on some of the cultural authority and legitimacy side of things. They having some issues with that, and then a little bit of an identity crisis that kind of goes on persistently in the chiropractic profession. As to what they really truly want to focus on and what they want to specialize in. And so it was that transition of, how can I use my passions to be able to help people, and kind of my outlook on healthcare, which led me to chiropractic. And then it was the realization that some of these problems and issues are much more complex and require more skills and more training, which only an MD or a DO or a physician can really have. And that was, the long, winding trajectory that I took to come to that realization. And I don't think, for me, if I hadn't gone through each of those steps, I don't know if I would have been ready to necessarily take that on and to do that. And so, people ask me all the time, do you wish that you could do things differently and go back and from the beginning, not play soccer in college and not focus on athletics so much, and instead focus on your schoolwork and trying to get your grades up and not taking the classes over the summer at the community college and, studying for your MCAT and taking it right away and going into medical school in the traditional way. And there are parts and times where there are pieces of me that say, yes, I wish I would have done things in that way because it would have saved me some time. But then there's a larger piece of me that says, I don't know if I would have been ready. I don't know if I would have, been able to really tackle medical school the way that I did, and kind of keep the perspective that I have now about medicine being my career of choice, and trying to maintain that balance, because coming from a life before where I had a good balance, that was a big priority to me, is to kind of maintain that.
Sure. And, I love what you just said, and we'll definitely tap into that a little bit. Something that I think was really great is, you could have gone back, right? And you could have totally hopped into medical school earlier, potentially. Mm-hmm. But on the other side of it, you had all these experiences, teaching, you had these experiences with clients, as a chiropractor.
Yep.
And that only feeds, that lets you see, like you were saying, that gives you perspective. You had that scope of, it's not just, I'm not just learning for just to learn, but that it's at the end of the line, it's for people.
Exactly.
And that's something that I think, not every student that goes straight through might understand. This actually might be a good point to emphasize is, when you do have that scope that, when things get tough in school, you learning things to the best of your ability and getting through those tests and everything, it is for ultimately to educate and to help other people at the end of the line, even though it's a long, the tunnel is a long tunnel to go through. The ultimate thing is to, as everyone wants, is to sit in front of another human being and help them, give them that knowledge that if they didn't interact with you, you wouldn't have, they wouldn't have had the ability to really amplify and, enrich their lives. So that's a really great point. So, now moving on, so you eventually had this kind of windy road, non-traditional.
Mm-hmm.
You ended up in medical school. Can you explain more about ability science and how that came into fruition?
Yeah, so having that background of being a chiropractor, wanting to go back to medical school, I realized was not a unique thing. It was a very common thing that I think a lot of chiropractic students going into the profession had a certain idea of how they wanted to practice when they got out, and then came to a certain harsh realization after they had finished their training. And I had actually done an interview on a chiropractic podcast called On the Other Hand, maybe 2010, 2011-ish. And talking about the lack of cultural authority that chiropractors have. And I had done it, and it went out, and I didn't really know how many people would actually hear it and how far it would reach out. And maybe a week later, I got an email from Jim Eubanks, who is the other co-director of Ability Science. And at the time, he had said, "Hey, I just heard your podcast, and I heard your interview on the other hand. I would love to, set up some time to talk. I think, we have a lot in common." And he's like, "And actually, I'm going to be on the podcast next week." And I listened to his podcast. He talked about his experience being a chiropractor and working within a large orthopedic spine group and kind of integrating into their practice model. And I instantly, thought that we had a connection, that we had a similar thought process, a similar vision for, how we wanted to utilize our skill sets. And so Jim and I became friends shortly after that. We discussed our ideas and our goals to take the MCAT, and go back to medical school. And then all throughout medical school have remained in touch. And when we both had talked about wanting to go into physical medicine and rehab, we said, are you having the same experience that when you sit at a round table with a bunch of your medical school classmates and they ask you to go around the table and say what you want to go into? I was always the person at that table as they came around who had the odd man out answer. The traditional, I want to be a surgeon, I want to be an internal medicine, I want to do cardiology. Those were the traditional answers. And then it would always come to me and I would say physical medicine and rehab, just given my chiropractic background. And always the responses were kind of a little bit of shock, like, well, what is that? I don't even know what that is. Why would you come to medical school knowing that that's what you wanted to do? And so Jim and I, talked about that, having that unique experience of wanting to do physical medicine and rehab, but having an entire medical school cohort, that had no idea what it even was, what it was about. And so we said, I wish there was a way that we could, kind of educate people on what, PM&R is and why we're choosing it and why we want to go into it. Because I think it's a great area of medicine that, is maybe misunderstood and underappreciated, and by medical students. And so we said, well, how can we do this? And that's kind of, the catalyst that led to us starting Ability Science, is just wanting to be an educational resource for both medical students and then other physicians, to utilize to kind of read a little bit more about the specialty, what they do, the diversity that exists within it, so that medical students can make more informed decisions when they're planning out their rotations, and not just, kind of be, funneled into the standard things, or maybe the things that they thought when they first came into school.
Sure, that's awesome. So I'm actually looking at the website right now. It looks great, by the way.
Thank you.
And yeah, absolutely. And so, for the listeners out there, could you just give us like a brief pitch, like why should people visit Ability Science, just to get a sense of, what can they get out of the page? I know you kind of mentioned it, more explicitly.
Definitely. So Ability Science really was supposed to be a way for anybody to go there and learn about the profession itself, learn about the specialty, and find out kind of what it's all about. And so there's really two different arms or two different areas where you could do that. One is in our Leaders in PM&R interview series, where we feature interviews with some some program directors and then some physicians who are out actually practicing, and they get to talk about some of the things that they deal with. We had some docs who focus on cancer rehabilitation, traumatic brain injury, pain, and some of the different areas and kind of how their day is and how they go about, taking care of patients and treating them. And I think that's something that medical students need, because it's one thing to say, oh, I want to be this, specialty, I want to be cardiology. But I don't think what we realize sometimes is what the day-to-day life of a cardiologist is actually like. And the same thing, I can say that, this is what physical medicine and rehabilitation does, but it doesn't tell me about what the day-to-day life of a physiatrist is. And so that's really what that interview series is all about. Is it's a written blog, style question and answer, to just give some background information for medical students who are thinking like, well, even if I wanted to do PM&R, what would my life be like, or what could I do with this specialty once I'm done? And then the other side of it is the vlogs, and that's it came to be because I was driving home from the hospital every day, and I had all of these thoughts kind of racing through my head, of what I had seen and what I had experienced, and I said, I wish that there was a way that I could share some of these thoughts and talk some of these things out, even just for myself. And it kind of popped in my head because Jim and I were talking about what type of content we could create. And I said, what if I did a vlog? What if I just set a camera up and I, kind of spoke into the camera about, as a medical student and as somebody who wanted to do PM&R, what are things like, and how, what am I thinking about? And what am I, how am I using each of my rotations to kind of strengthen my skill set going forward, and heading into the match? And that's kind of where everything started out. And then I realized that, doing it kind of awoke some of the passions that I had before I went into medicine and before I even entered, medical school or even college, of, acting and kind of being in front of a camera and speaking. And then also the artistic side of actually shooting film and video and splicing it together with music and, putting together this whole thing. And I found that making the vlogs was almost as therapeutic as the actual shooting of the vlogs and having that conversation out loud. And so those two things really are the core of Ability Science. I think we've gotten a lot of feedback from medical students that say that they like the vlog because it'll propose a question, or I'll say something that they might have never thought about, and then that causes them to go back and kind of search themselves and find what is important to them or what they would have done in that situation. I share some unique experiences that I had rotating, having a deaf patient who was pregnant who wanted to hear her baby's heartbeat but couldn't obviously hear the ultrasound, and so we had to bring a speaker into the room and lay it down so that she could put her hand actually on the speaker and feel the baby's heartbeat. And those are the types of things that I think any first and second year medical student who's trapped in a cubicle studying, that's what they want to hear. That's what they want to know that they're moving towards, and that's why they're putting in the work. And so that's kind of how the whole thing started, and the vlog format was just kind of a natural thing for me to set up a camera and just speak and kind of get up there and do that. Those are really the two things that I think people would gather and maybe find somewhat resourceful on ability science.
That's amazing. And, there's so many good points that you made in there as you were speaking that I would love to highlight. Number one is your page offers the ability for students and people who have not experienced that life yet to step into the shoes of that doctor's life, or, even with a vlog, right, to step into the shoes of what your day looked like, what you saw that day, what was your perspective of that moment. You might be even, asking questions and those things. So it is a really good glimpse into that life. And what a beautiful tool, right? If you think of a student or a potential pre-med student, and they're like thinking, what do I want to do with my life? What better than to be able to physically see, like, on a daily basis what people are doing, what you look like after that day, what your behavior's like, kind of getting a sense of that. That's really good. Something that in a previous interview we talked about, if someone really does their homework, and they do all their shadowing experiences, they ask the right questions, and they see stuff like what you have out there, they're going to feel more empowered to be like, this was the right decision. I'm going to be able to tough this hard part of medical school out so I can ultimately get to that lifestyle or that work that I really wanted to do, Yeah. So, kudos to you for that. The other thing you mentioned, which I thought was really powerful, was your own personal story of how you kind of reignited a previous passion of yours. And that's something else that I really want to highlight, that gets me excited. For example, this podcast, another example of, something that you can take your personal voice and speak to other people and learn. You're doing that with your website. You're asking questions from physicians, gathering knowledge, so you're learning. But on top of that, you have the vlog that lets you be creative. And that's something that's so important. We're all humans, and we can utilize our human creativity in some really cool ways. So, that's great that you built, that part out. And it's very inspiring. And I want the listeners to hear that. It's so inspiring to be able to do that for yourself, but also as you guys listen in, what are some creative ways you guys can, use, Dr. Farrell here, with all of the stuff that he's doing. It's awesome. I'm like, this is great to have you. It really is.
Thank you. I think that you just touched on something that I've said so many times before, and I think that's one of the reasons why when I first learned about your podcast from Dr. Desai, and I looked at it, I was like, wow, I feel like we have spoken before, like in like a previous life or something, because it makes no sense to me at all that the things that get us into medical school are these unique things, the skill sets that we each bring that make us stand out and are separate from everybody else. And whether it's that you're a pianist, or I worked with a medical student just recently from Georgetown who was like at Juilliard for playing jazz guitar, or whether it's the passion that most of these young men and women have for like giving back and donating time, and the little things that set them apart from everybody else. And we bring all this uniqueness together into medical school, and then somewhere along the way, those things fall off. And the most important thing that we think that we should do as medical students is to study hard, be competitive, and be able to get that residency, or get that good board score, or get that good GPA, or be highest ranked in the class, get honors in a rotation. And slowly but surely, all the things, for me, soccer, being creative, painting, playing the acoustic guitar as terribly as I play it, but playing it nonetheless. All of those things fell by the wayside, and the only thing that was important, it was like tunnel vision on this one goal, and we lose all of that individuality that we brought into medicine in the first place. And I think that it's really important, as you were saying, for even pre-meds and MS1s to hear, don't let medical school take away your individuality. Find ways to kind of let that show through, and let that be something that kind of helps your career, but allow it to kind of highlight those things that you're good at. If you're not good at getting in front of a camera and speaking, as I was, then maybe the vlog format is not for you. But there's definitely something out there. Maybe you're a very talented writer, and just starting a blog talking about your experience would be great. There's so many ways to do it, and that's something that I never thought about until I was in it. And hearing you say that and kind of what you're doing here with the Happy Doc is great to highlight all these things for the young physicians to be coming in.
Wow. Thank you. Thank you to you. Thank you for, having positive feedback. That's awesome. And something else that I want people to listen in on, as we're talking about this is there's a lot of, and we can talk about this, but I've beat this to death, I think, on this podcast a little bit, is fear. We're afraid to go for the things that we might have originally loved to do. All of a sudden you're in this really structured medical school. You have all of these assignments and those things. My advice is just to take the first step. Mm-hmm. Go for it. Take the first step. And you'll be surprised how, all of those thoughts that you might be fearful for, you go for it. And then it's complete opposite. You get awesome feedback, because I think people are looking for, some more inspirational things. People are looking for people to be creative. And also on top of it, if your dream, for example, is you want to make a really cool vlog or whatever it may be, but you don't have those skills, you don't have to have all of the skills, right? Like, Mike, with you, like maybe Jim takes on some of those parts that you're not as skilled at, and you guys work together and collaborate. So, you don't have to, you can have a collective dream with other people. But
100%.
Yeah. So, there's so many creative ways to do things once you get things rolling and let people know what your intention is or what your dream is. People will feed that, So, and I'm sure you've seen that in your life. You had that podcast episode. You spoke on there, and then someone reached out to you because they connected to you. If you didn't take that opportunity, that wouldn't have even built out for you.
And I can say that from experience, as somebody who thought those same thoughts of like, well, maybe I shouldn't do this, because the general feeling that med students have is I shouldn't put anything out there, because what if residency programs see this and they don't like it? And that, I got more positive feedback on the interview trail about the vlog than I did about my research, that was published, and some of the other things that I've done that I thought would academically be, would kind of get me some kudos and some notoriety. And so many people wanted to talk about, tell me about this vlog. Like, what is this? And at the end of it, we're very positive about it. And so, here was something that I thought I was a little bit afraid to do, because I was like, man, is this going to be received the right way? And just did it. And somebody from the Association of Academic Physiatry reached out and said, like, we really loved, the vlog that you did about coming down here and doing your poster presentation. And I've had more positive feedback from it. So just like you said, if you want to do something, just take that first step, because it's not as bad as you think. We always catastrophize, I think, everything a little bit too much, but it always ends up working out better than we think.
Yeah, definitely. I could talk about this for hours, but to move on a little bit, we also touched on the idea that it's so important for people to kind of get a glimpse of, what it is actually to practice as a doctor. So you're an intern. You've been going through, you are an intern, correct? Yeah.
Yes.
So, you're going through this process through your first year as a doctor. So, for the people who haven't lived that life, what does that feel like on a day-to-day basis, and how do you keep yourself afloat? The hours are long and all those things. So what do you do to kind of maintain yourself?
Sure. It's definitely whatever anybody tells you how intern year is going to be, or how your first year of residency is going to feel for you. I can tell you that it's definitely an individualized thing, and your path and your experience doesn't have to be what their experience was. I can definitely attest that being a medical student and feeling, as a kind of like an outsider and having all this knowledge but not having the practical skills to be able to utilize it, that's a tough thing. But it's a much different feeling when you're an intern and your name is actually on that chart. When you log into the EMR, right next to it is your name as being the person who's solely taking care of this person. And you feel this sense of responsibility for them. And things are not going to always go the way that you would hope. And, it's really easy to take that new sense of responsibility and the stressful environment of the hospital and allow that to impact your own personal life. And I think that the Emmy Farrell TV channel was really my response to that and my way of preemptively doing something to give myself an outlet and something to do when I left the hospital that had nothing to do with hospital life. And so, that was important to me to maintain some sense of identity and some outlet to have so that I could leave. And then also leaning on the people around you, my girlfriend, my parents, my friends back home, calling them and being able to just kind of like talk about your day and talk about the stressful things that you experienced. Those, two things, having outlets, having people to talk to about it, are hugely important. And then, the last one was finding ways to kind of focus on yourself and to take care of yourself, both mentally and physically. For me, that means, starting to get back in shape, trying to incorporate exercise back into my life because it was non-existent for a while there. And then mentally, trying to reincorporate some of those things that I did in the past, one being mindfulness meditation, to help, just kind of cope with, deal with stress and remain happy, even during those crazy, stressful, long hours. And that stress of, having to care for somebody and take care of them and the magnitude of that, being able to cope with that.
Wow. I love that. And so I'm actually going to conceptualize what you said a little bit. I don't think I've heard anyone call it like this, but this is just the way I perceive it. And that is you set what I call energetic anchors. So, and for me, that's a concept in which, for example, you have friends and family, right? You've put an investment into them. They know who you are. You've had positive experiences, with them. So they are a form of anchor. Okay. Yeah. On top of that, you set an energetic anchor, which is the Emmy, Farrell TV, which is this space where you can be yourself. It allows you to put in your energy of who you are into that, not only for maintenance, but also maybe to uplift and inspire other people, right? So and this all started prior to starting intern year, correct?
Correct, yeah.
So what you did is you were kind of in a positive mind state or mindset. You set that anchor of an idea while you're in a good mindset, because I would argue, had you not set that anchor prior and maybe you were burnt out or exhausted, this idea wouldn't have come, Yep. But you actually set the anchor down before you started. So now this is like a self-feeding process that you set beforehand. So what I mean by an energetic anchor is when you're in a good state of mind and you have an inspiration or something comes to you, setting the anchor or setting that project in motion helps refeed you later when you're not, maybe you're not in that state of mind. It helps re-inspire you. It's the same thing that happened with this podcast. Had I not done it, and I started intern year, I'd have probably been a lot more exhausted. I can tell you that I can have the exact same experiences that other interns or doctors are having, but for some reason I'm just maintaining my positivity a little bit more, and it has to do with these creative projects. So that's another thing I want to conceptualize for people listening is set an energetic anchor, set something that keeps your energy afloat. I guess anchor wouldn't be the right term there, energy buoy, but something that keeps your energy afloat when, you're starting to dip a little bit, family members speaking about stuff. Those are other concepts, but I love that. That was a great point you made. And so, moving forward from that, can you tell us more about, Farrell TV and, kind of the videos and stuff that you have on there?
Yeah. Jim and I talked about how it seemed as though the ability science vlogs, although they were anchored in physical medicine and rehab, sort of started to take on this aspect of they were kind of about my life and about me traveling around and my life as like a medical student pursuing a residency in PM&R. And that was great, and we loved the fact that it was doing that and that it was a place for students to kind of come and be able to, take a real first-person perspective into what that would be like. But it was drifting a little bit away from the overall message of being a really great resource for physiatry-specific content. And we, had the discussion, and I said, maybe what I'll do is I will kind of differentiate, and I'll have one channel that is my own, that's more focused on my life, and then I'll come back to ability science to talk rehab-specific things. And so I'm working right now on a kind of demystifying concussions video. And that will be a rehab-specific thing that will probably appear on ability science. And as opposed to, my kind of day-to-day life vlogs. So it was really just more of like a strategic decision that we made to try to keep the content more focused and allow people who are going to ability science looking for rehab specific content find that there, and those who are more interested in just everyday life stuff and kind of my experience going through the transition from being a medical student into a resident, they can find that on Farrell TV. And so it was just a way of kind of branding, I guess, the idea and keeping the two brands separate.
Sure.
And that just made it a little bit easier for us to market to specific audiences.
Sure, yeah, and to maintain like the purity of that content. But the thing is, like, you can also feed into it, right? Like you can reference ability science, obviously, in your vlog on Farrell TV, but you could also maybe reference during the ability of science, you might reference the vlog. You don't have to. Anyways, I think it's that makes a lot of sense. Yeah. So I want to now refer to one of the videos I actually just watched, and that was actually your match day video, because I think content that you produce, such as that, it's very uplifting, it's inspiring. Think about a first year student. Think about like a first year student that's really down and exhausted, and then they watch like this match day video. I think that's just like, oh, this is why I'm doing what I'm doing. Can you comment on that a little more?
Yeah, at first I kind of racked my brain so much about, well, what should I like do and what should I talk about and what should the focus of these videos be? And I actually started listening to and reading somebody who's kind of like a more, I guess, online like entrepreneurial figurehead named Gary Vaynerchuk. And he made a point that really stuck with me. He said, don't create content, just document. Document your life happening, because your life happening is probably more compelling to other people than created, manufactured content. And so the idea for the vlog became, and you can see on Farrell TV, I've done manufactured content. I've done a whole video about like the stress of waiting for match, and I've also made a video about the match process kind of being like the draft. And so there are some comical videos and things that I made that are more just my own cerebral things getting out there. But the stuff that's the most popular and that people respond to are not the content being created, but more just the documentation of life and the experiences that I'm having. I think the two videos that got the most views and the most shares and everything and the most comments were the video of the match day, and then also the video of me going to my friend Mike Francois's wedding with all of my medical school friends. And then, the videos of Alyssa and I traveling to Washington, D.C. to look for apartments. It wasn't, thought out. It wasn't planned. It was more just kind of like filming as we go. And it was not really creating content. It was documenting, as Gary Vee, says. And that stuff ended up being the stuff that I think is most relatable and what people really started kind of gravitating to and what they enjoyed.
That's awesome. And yeah, you look at that like match day video, for example, and you can see like the legitimate excitement of people as they're like, opening their letter, so to speak, or looking it up on their phone, right?
Yep.
And you see the name that, they see the name of the program they matched into. And like, that's like, you can't fabricate that moment, like everyone's super pumped, everyone's excited, everyone's cheering. But also like there's some people in there where they're not as happy, right? You can't like, you do almost see the reality of that moment, right? Whereas if it was manufactured, it'd be like how to match in your ideal program, which is great information, and people, obviously love that too. But yeah, I think definitely there's a lot of utility to that. That's so cool.
Yeah.
So that being said, Mike, we touched on, kind of your journey throughout this whole conversation. Generally what I like to leave at the end is just a few questions. Number one, who inspires you?
Wow.
And I know that's a large question, but just one or two people maybe.
Yeah. I would definitely say that I know it's like a very cliche, type of a thing, but my parents have always been, a very big inspiration to me. They really have kind of created an environment for me where I didn't feel necessarily afraid to do any of these things. My mom is the traditional Italian mother who her son, anything that I do is the greatest, thing to her in the world. And she's always going to be proud of me, whether it was when I was working in, a school district, pouring concrete over the summer, and riding on the back of a garbage truck. She was proud of me. And whether it was that I was pursuing teaching or whether it was that, my medical school graduation day, she's always been, proud of me. And my father has always been so supportive of, my whole athletic career and taking me to practices and doing all those things. And I think that, their overall outlook of, being supportive, being nurturing, but allowing me to kind of make mistakes and, approach life in this kind of haphazard way that it's allowed me to make some happy mistakes and end up where I am. That's been inspiring to me. Just that kind of love of for family and the closeness has always been, something that's inspiring for me. On the professional side of things, I would say that, guys like Kevin MD and Z-Dog, I've been following Mark Reed on Twitter, and those guys just, kind of giving some perspective into the life of a physician and removing some of the mystery and some of the, the fact that physicians are people, first, and that they have lives outside of medicine. And Z-Dog, I think, is like, one of those people who maybe does that the best right now, because his with the cameras and everything, he's so out there and he's so exposed to it that you get to see, like, this is just a regular guy who every day goes in and then, is this physician, and not that he's a physician first and some like robot who just, cranks out diagnoses and treatment plans. And I think that's really important as we move forward with reconnecting with the public, because I think, physicians have maybe fallen out of favor a little bit as we've pulled away from the public a little bit, and we've moved towards this more evidence-based model of care where things are a little bit more regimented. People don't feel like they're a part of the decision maker, or that they're, coming together with their physician to make decisions. I think it's really important to use things like social media to reconnect with people and just show them that or people, and that we're here to support you, and that you can come to your physician and talk to them like you would a friend or something else. You don't have to be nervous or afraid. And so I think those guys are definitely, kind of leading the way. I'm just hoping to have, a fourth of the impact of some of the stuff that I do that those guys do. But they would definitely be people who inspire me.
I love that. Awesome. So, for those listening, definitely check those great inspirers out as well. And the last thing I like to ask is, what's one tip, what's one takeaway given your journey that you would like to leave with the listeners today?
So, number one, I think my overarching theme in life is going to be, it's never too late. It's never, the decisions that you make, like if you want to find, that your life feels fulfilled, I think, that's not going to necessarily come from one thing. It's not going to come from your, friends and your families and the relationships that you have. That's not going to be enough to fulfill it. It's not going to be from just a job. You're not going to become a physician and then that's it. You're going to be set for the rest of your life. It's not going to come from one individual hobby or something like that. It's kind of a collage of all of those different things. And, it's not, if you're somebody who, like me, didn't want to do medicine, but now you're thinking that medicine is where your heart and your passion is, take that leap and take that first step to do it. And I think you'll, be pleasantly surprised in the end. And the same thing with anything else. If you have a passion and you have something that you love to do and that makes you feel fulfilled, just because you are a physician or just because you are a medical student or a nursing student or an accounting student, it doesn't mean that you have to give up your complete identity just to pursue these things and be good at it. And I think that's crucial in kind of me making the discovery and starting the channel, and I think that will be crucial in me going forward into my career as a physician, to just kind of maintain that outlook.
Awesome. Well, with that, ladies and gentlemen, that is Dr. Michael Farrell. It's awesome to have you. You have a very inspiring story, and I know that people listening will definitely take a lot away from this conversation. So thank you so much for being on today.
Thank you so much for having me. It's been a pleasure, and I love, like I said, I love what you do. Keep doing it. We really appreciate it.
Awesome. Take care.
Thank you.
Hey guys, we hope you enjoyed this episode, and we want you to definitely subscribe to our social media channels. Check out the Happy Doc on Facebook, iTunes, Twitter, and Instagram. Please like, subscribe, share, and send us feedback. And please check out the website, www.thehappydoc.com. Again, we hope you enjoyed The Happy Doc, the voice of fulfilled physicians. Peace out.